A Chinese doctor recounts seeing how an old man was murdered by an unjust healthcare system. NTD Xiahua Gu has more.
Dr. Liu said he witnessed another doctor murdering a patient inside ICU. The doctor injected drugs that caused the patient's death.
A while after the injection, the old man's body started trembling.
The patient was a man in his 80s. He was sent to the intensive care unit where Liu was an intern. To protect Dr. Liu's identity, we've hidden his name and altered his voice.
He had respiratory failure and slight heart failure. He wasn't an urgent patient sent by an ambulance. He still could have recovered.
ICU treatment is costly. After 4 or 5 days, the man had over $7,000 to pay. The problem was he couldn't afford it.
The hospital wouldn't shoulder the cost, but doctors, nurses, and all staff in the intensive care unit have to. The hospitals wouldn't spend a penny. The system just works like that. You may not be familiar with it. Usually the Bureau of Civil Affairs should pay for it, but they refuse because this old man has children. The children don't want him to be treated. They said, "We're working in other regions. We won't be back, and the hospital can decide what to do with him."
Liu said he remembers it was a morning in early January. He saw the deputy chief of ICU injecting drugs into the old man's body. He thought the deputy chief was trying to save the man from dying, but he didn't see any emergency care equipment. He questioned other staff about what the deputy chief was doing.
At the time, all the doctors and nurses in the ICU were pretending to be busy with their own work. They knew what was happening, they just didn't say anything.
Liu said a while after the injection, the man started trembling.
Because he was injected with very powerful respiratory stimulants that are undiluted, he started to have quick and shallow breaths.
Liu then saw that it was potassium chloride and lobeline that was injected. He says potassium chloride can induce cardiac failure. The deputy chief noticed Liu watching and asked him to remove the man's breathing tube.
Basically, he means if you reveal anything about this, then you will be held responsible as well. He asked me to remove the tracheal intubation, so I would be the one that ended the man's life. I was forced to do this. I've been very depressed about it.
Liu says what he saw isn't a standalone incident. It's common and still happens.
Widowed seniors, those without children or whose children work in other regions, after their situation worsens and they're sent to the ICU, if the children don't submit the fee in time, the elderly are secretly killed.
He said in the Chinese healthcare system, hospitals have to make a profit. The earned money then goes to the county-level finance bureau. If the hospital doesn't make money, then management's jobs are on the line. Doctors and nurses have to pay for medical costs if patients don't. He said the situation is cruel and very real. He said the man's death was caused by the healthcare system. Reporting by Xiaohua Gu, NTD News.